So good afternoon, everyone. My name is Katie Chipungu. I currently work as a psychologist at the DCVA Medical Center, so right across the reservoir over there. Today I'm going to be talking about careers in psychology, and I do understand you guys are STEM, so you guys might be thinking, how in the world does psychology fit in the STEM? And I'll try to get you guys there. But it is a place where you can do research and you can do science. It's not something people typically think of. They think of it more of a soft science. But there's a lot of research to be done, and in my mind, that makes it a STEM career. All right. So how did I become a psychologist? Or what education would you need if you wanted to be considered a psychologist? So the definition of psychologist typically means someone who has a doctorate degree. If you don't have a doctorate, like maybe a master's level, you would be thought of more of as a counselor or a therapist. So when I say psychologist, I mean someone who went to a whole lot of school like I did and has done research or a clinical degree. So there are two ways to become a psychologist. One of the degrees is a PhD, and the other one is a PsyD. And what is the difference? That may mean nothing to you guys right now, but a PhD is a doctor of philosophy, and it's got a strong emphasis on research. So you would want to get a PhD if you wanted to contribute to the body of literature, if you wanted to answer questions, if you wanted to learn or contribute to people's learning about different psychological issues, you would go more towards a PhD. One of the other benefits of a PhD is they typically pay for your degree. So if you're going to go to school for a really long time, that sounds like a lot of loans. PhD, because you are either doing research while you're there or you're a TA, like a teaching assistant, you're typically getting your tuition paid, and you might also get a bit of a stipend as well. A PsyD, it would be a degree that would be more appropriate if you really wanted to be more, you want to do interventions, you want to do diagnosis, you want to work one-on-one with people, and you're not really interested in research. A PsyD would be a better fit. You learn how to understand research and read research articles, but you may not have to do a dissertation per se to graduate. You may not have to do your own research project to graduate. And both of these degrees would allow you to be an independent psychologist that saw patients or did interventions. It would just be a different type of school. Also, just to let you guys know, if you're doing a PsyD, you're typically paying for it, so you end up with more loans in the end. And they tend to have bigger class sizes. So I went to school and got a PhD, and there were maybe 14 people in my class. For a PsyD, you might be looking at 40 or 60. And the difference is typically kind of what your endpoint is. So let's say you want to be a professor at Howard, you would be going more towards your PhD if you want to be teaching. If you're thinking more you want to interact with patients, you also want to train the next crop of psychologists who are working with people, a PsyD might be a better fit. Yeah. And so before you get your PhD, you have to go to undergrad and get a bachelor's. So I went to Howard for undergrad. I got my bachelor's in psychology. I minored in math. And then I applied for graduate school, and I went into a program with just my bachelor's, and I got my master's as I went, and I got my PhD in the end. Let's see. Any questions so far? So I will say for a bachelor's in psychology, you might not be able to do much on your own. A master's, it depends on the state. So if you're in Michigan, you could be a master. Well, actually, I'll take that back. You could work as a master's level psychologist in most places. You get paid a little bit less. And in some states, you might still have to have a psychologist over you, like someone to sign off on certain things. For you to be independent in practice, I would go the PhD route, even though it's a lot of school. Limitations. So you could, if you wanted to like work one-on-one with patients and help them with their problems and talk to them, you're going to at least need a master's at minimum. I can't think of any degrees any ways you could work in a counseling position and get paid for it and not be in school and not have a master's. So if you're thinking I want to work one-on-one and help people, I would go the master's route. What I will say is, let's say you're a student who wants to do okay, I take that back. There are some situations in which at a bachelor's level you would be able to interact with people, but you would be working under another psychologist. So you would have someone over you kind of checking in with them, and them signing off on your work would be, I think, the limitation. So if you want to practice all on your own and not have to check in with anyone, PhD. If you want to, but you could do it with a master's or a bachelor's, you just might have to have someone sign off on certain things. You might need supervision in certain states. And it sounds like a nitpicky thing, but it's something I didn't know about in school. Like, I was like, oh, you become a psychologist, but you need to do different things in different states. like DC, Maryland, Virginia, all have different requirements for what you would need to do and what you need to study to be a psychologist. I hope that answered your question in some way. And then also, and this is going to sound kind of nitpicky, people, in terms of people taking you seriously, people, they tend to like letters. So there might be situations which you know just as much as the other person, but because they went to school 3 more years, they take this person's opinion more seriously. And that's just being honest. A lot of times they do that. And for that reason at work, I often have, so I work on a team with like nurses, doctors, physical therapists, pharmacists, and they will introduce me as Dr. Chipungu to patients, so they take it more seriously. I was the same person before and after I saw them, but kind of just putting that in front tends to give people more credit, especially in hospitals, where they're used to more of a medical model. So when you hear doctor, they're like, oh, okay, even though they shouldn't. You have the same knowledge anyway. So that's what I would say in terms of the bachelor's and the master's. Yeah, I went to 4 years of undergrad, and then I went to, so from the end of undergrad till I got my PhD was 6 years. So I was in grad school for 5. I got my master's along the way. It was either like 2 or 3 years to get my master's, 5 for the PhD. But for my particular degree, the clinical one, we have to go to something called internship. And it's kind of like a medical residency, but we do it before we graduate. So you apply, you put in applications, and you match, and you go somewhere for a whole another year. That's not where you're in grad school. I went from Miami to Detroit, and so that would be my 6th year. So it was 6 years for that, and then I had to do postdoc, which was also a year. So it's about 7 years from the end of undergrad to I was an independent practicing psychologist with my own license. So it's a lot of school. States want you to have, even after you graduate, they want you to have more practice working with patients that supervise, and that would be a postdoc. So not everyone does one. A lot of times people were like, look, I've been in school forever, I need to work and I need money. And so they go straight into a job that might offer supervision. I did a postdoc because I wanted to get some more specialized training, and also for things for licensure. But yeah, so it was about a 7-year commitment. Some people did it in 6, and those would be my classmates who had a master's coming in, or also were just more focused and were like, I need to get out and I need to. I've been talking a little about this as I went, but I got my bachelor's from Howard in psychology, and I did a minor in math. And one of the things that was helpful for that is there's a lot of statistics in a PhD in psychology, and often people don't like math and they shy away from it. So this made me a lot more attractive when I was applying for things, because they're like, oh, well, she can handle the stats part. And I took a lot of stats when I was in grad school. Not using as much of it right now, clinically practicing. When I was doing research, did that a lot. And I mentioned I got my master's as I went along. So for the master's, I did a smaller research project than what I did for my dissertation. And then I graduated with my PhD from the University of Miami. And like I was discussing earlier, so before I had my doctorate, I had to finish internship. So I matched at Henry Ford Hospital. It's in Detroit. And I worked essentially as a psychologist, but with supervisors. So for me, in the hospital setting, if you're in a hospital that paid psych, I would show up. So sometimes I would be working with patients who might be sad or anxious. A lot of times I saw patients who had cognitive impairment, maybe are coming off of substances and were presenting in that way. Often I got referrals for patients who doctors had a difficult time working with, and they wanted to kind of figure out what was going on. And then for postdoc, I did a similar thing, but I worked exclusively in pain clinics. So people who had pain for more than 6 months and they're trying to find ways to cope with it, whether it's medications, physical therapy, or learning coping skills with a psychologist, or if they wanted to get devices to help with pain, I would do the initial evaluation and figure out, would they be a good candidate? Are there things they could do that could improve their ability to cope with pain? And that's my educational background. So I will point out, as you're thinking about psychology, and this was a challenge for me when I was applying for places, is you're thinking about quality of life, like where do I want to go live for the next 5 to 6 years? But you're also thinking about your mentor match. So you're thinking about, where am I going to go to school where they're studying what I want to study with someone who would be a good mentor, and I could have a good quality of life. And that can be a bit of a balance. So I ended up in Miami, but some of the other places I applied were places, UCLA or Pittsburgh or University of Maryland, because I was trying to stay home, but it wasn't a good research fit, so that didn't work out. But you would likely have to move somewhere for a number of years. And so I don't want to say you have to pick somewhere where you'd love to live. It's a lot of fun, because you're going to be really busy. But that's something to keep in mind, because grad school's hard. it was rewarding. I would do it again, but it is hard. It can be stressful. And thinking about that, this is at least a 5-year commitment where you're going to go, is something to keep in mind. So why did I do psychology? I've always been interested in why people do things. And particularly for me, I had an interest in health. So in African American communities, you often find higher levels of diseases that have a behavioral component. So things that can be prevented, like heart disease, things that you would need screenings for. Just things that in my mind, I was like, well, why are these things happening if we know what you need to do to not have it, or we know what you need to do to reduce it? So that's what initially got me into psychology. I was like, well, I'm going to figure out why people aren't doing the healthiest things for them, and that way I can help them, was what drew me to it. Also, so I said an interest in health disparities. And also, it's a lot of career options. So when I went into grad school, I thought I was going to come out and be a professor. I wanted to, come back here. I wanted to do research projects, answer these big questions about health disparities, influence public policy. And one of the things that happened along the way is I really started to like the individual work I was doing with patients. And I think I saw that change happen quick. That change was right in front of me, as opposed to doing research articles and putting things in that have an excellent impact, and we need people to do all the different types of psychology. But I really enjoyed that one-on-one. I'm a people person. I like to talk. And so that leaves that option. And let's say I, at some point, get tired of being working as a psychologist one-on-one. You can go into administration. I could teach other people who want to be psychologists. So there are a lot of different career options, and that was something that was appealing to me. And it fit my strengths. Like I said, I like to talk to people. I've always been someone that listens. I'm usually the person that gets called when people are having a problem to talk them through before I was a psychologist. So it was something that fit pretty easily. And I had some family members who worked in social work. So we're helping family. Psychology wasn't too big of a jump for me. And so some of the things that come up that can be a bit of a challenge are getting into grad school. It's very competitive. A lot of times, as it gets more and more competitive, there are fewer slots, and also people are doing more to prepare. So in undergrad, I did a program here at Howard where we did research for about 2 years. So I learned how to do research. I did a summer research program in San Francisco for 3 months, where I lived there, worked with a mentor, put together a research project, presented it at the end. And with those things, a grad school could look at me and be like, okay, she's shown that she can do the things that would get her through this program. But a lot of times for grad school, you have students already coming in with papers published. And that's kind of, in research, one of the things they want to see. They want to know not only are you doing this research, but you're able to share it with the community. And the people looked at it and did peer review. They found it to be great research, and they shared it with other people. So something to think about is, if you wanted to go to grad school in psychology, is in undergrad, getting research experiences, whether it's working with a professor who's already here or finding something to do during the summer. It shows that you're able to do the things you would need to do in grad school. Time commitment. You asked me earlier how long I was in school. For a long time. And I will point out, let's say you started and you realize it's not for you. That's okay too. I had friends who didn't finish their PhDs, or they went in clinical like me and then dropped the clinical part and only did the research. So they got out of school, well, they finished 2 years earlier than me because they didn't have to do internship, they didn't have to do postdoc, and they're still doing research in psychology and helping people, but they didn't do that particular program. Yes, relocation. So I moved to Miami, which doesn't sound like a downer. I enjoyed living there for 5 years, but you do have to move. So there were people in my program who were married or had kids, and that's something to consider too, because you're taking someone else with you. When you go. Burnout is stressful, it's tiring, and at a time where you're trying to help other people's mental health, you might be really stressed out yourself. So something to keep in mind is, like, how do you care for yourself when you're doing all these different things? Because I think maybe my 3rd year, I was teaching a class, I'm doing therapy for other people, I'm working on my master's, I still have my other research obligations, I'm also still taking classes. So you're doing all of these different things, and you're wondering, when did I sleep? And that's a really good question. Boundaries. So when you say you're a psychologist, people want to tell you all their problems, right? That may not be the most appropriate place. I don't tell people I'm a psychologist on a plane, because you're stuck for the next 1 to 6 hours. They want to tell you all these things, and I'm not going to do therapy on someone I just met. One, because I don't want to, and also because it's not ethical. If they really need help and they're in crisis, they need to find someone who's going to give them a traditional therapist role where they can have confidentiality and all of those wonderful things. So trying to like establish that can be a challenge as well. Self-care, like I mentioned, you're likely doing a lot, and those bad habits like not sleeping and working all night are really rewarded when you're in school, but they're not really good long term. Like, you need sleep. Don't be team no sleep. You will get sick. Social support. So it can be isolating as well. So if you're in maybe like for you guys, if you were coming from DC and then you went to school in another major city, all right, that makes sense. You're used to being in a city. I'm used to seeing a diverse group of people, but sometimes these programs are not in places like that. So you might not have that typical social support you usually have. You also might be far away from home. I was lucky enough to work with a group, to be in a program where we clicked, where I was able to like, I lived with one of the other people in my program the whole time I was there. So you had like friends and social support, but it can be kind of isolating sometimes, especially if you're in a competitive program, because in addition to your friends, you wanting your friends to do well, you guys are also sometimes competing for the same things, whether it be grants or internships or things along those lines. And typically, if you're going into STEM, you have a lot of smart, competitive people. So that's something to keep in mind, too, that you're trying to build social support while you guys are also trying to sometimes outdo each other. And mentoring, finding someone who's been through this before, who can walk you through what things are normal and what things might be more stressful than they need be. One thing I found very helpful was participating in this organization called Black Graduate Students in Psychology, and they would meet once a year, and so you got to meet other Black students in psychology, because you might be the only one in your program. For me, I was the only one in my year, but I was in a diverse program. So the fact that they had one out of the 14 was really diverse. There were some programs I went to where they had one for all of the grad students they had in psychology. So you might be the only one there. If you're at a predominantly white institution, if you're at Howard, that would be very unlikely. But if you're thinking about that, that's something to think about as well, finding other people who've been through it. And I don't mean to say you can only get mentoring from other Black psychologists. Everyone in psychology has something to offer. I'm just saying that was one of the things that I saw outside of my particular program. So I put this up here because you guys are wondering, how in the world is psychology STEM? There are a lot of different ways you can do psychology. So I'm a clinical health psychologist. That's just one of these. And a clinical psychologist is someone that goes and helps people with diagnosable disorders. So someone with depression or someone with social anxiety, maybe someone who has Alzheimer's or dementia. And we try to help them reduce symptoms, live the best life they can do. You might also do a lot of assessment and intervention, so figuring out, someone comes to your office and they're having a rough time, we got to figure out why. And the health psychologist part means I focus on helping people make healthier decisions or coping with the medical condition that they already have. Like, how do I help them, despite the fact they have pain or despite the fact that they have cancer, cope and deal? So that's what I do as a clinical health psychologist. Does anyone want to guess what a cognitive psychologist does? A cognitive psychologist wants to understand how people think and how they might remember things. They're trying to understand that process of thinking in and of itself, which sounds like, oh, don't all psychologists do it, but no, these people are interested in researching how we remember things, how we learn things, what information gets in. Anyone want to guess what a community psychologist is? Yes, they're interested in how people interact with their community, how they might be able to have healthier relationships or be healthier, and more. So they help people with problems too, but they do less. While I'm looking at someone like, okay, you got anxiety or depression, they're more interested in how do we help this person just function in their community and interact with it. So less diagnosis and more, okay, how do we just help this person where they are? Great guess. Counseling psychologists. So this might be someone who works in your school. So if you guys have a psychologist at your school, they're likely a counseling psychologist. Do I have school up here? Yeah, no. They're likely a counseling psychologist. So they have the same degree I have, but they focus more on the whole person and well-being. They're usually in school settings, maybe undergrad or university or a high school. They may be the first person to notice if someone has a learning disability or a learning disorder and how to help them best learn. So that would be what a counseling psychologist is. Developmental psychologist? Exactly, you guys are getting it. The names are pretty self-explanatory. So a developmental psychologist wants to know from infancy to the grave how people develop, what might be normal, what might not be normal. And you might run into a developmental psychologist if, you know, you have a kid growing up and they're struggling in certain ways, or maybe they're not developing language at the time or in the way one might think. So you may, if someone has autism, they might likely run into a developmental psychologist. But from a research perspective, you think about developmental psychology as a place where you learn exactly how people develop and how they age, what's normal, what's not, what are particular risk factors. For example, the program I went to, I had some colleagues who were studying children with autism, but also their non-autistic siblings, to kind of see what people with kind of similar genetic makeup, what people put people more at risk, and what are things that present in these siblings that didn't present in other people. And I already talked a little bit about educational and school psychologists when I was talking about counseling. One thing I'll point out, so clinical and counseling are very similar. The difference tends to be where clinical is more diagnosis, more medical in some ways, and counseling is more, let's just think about how people are coping and dealing, and not necessarily we have to put a name or disorder on it. Environmental psychologists, what's wrong with it? How can we better interact with it? How do people interact with their environment? So you might want an environmental psychologist when you're trying to figure out how to set up a classroom and the best way for students to learn. How do you design a restaurant or a store to get people to spend more money or eat more food? You will see a lot of this maybe in industry where they're trying to figure out how to maximize productivity or efficiency just based on how they set up the place. Experimental psychologists. Yeah, so they run experiments on people. I'm not going to do that to you guys today because I haven't done any IRBs and gotten your consent, but experimental psychologists do exactly that. They want to understand these psychological issues or just anything, but to do that they do experiments. And I'm going to show you guys some psych experiments later on to give you guys an idea of what that is. But yeah, experimental psychologists run experiments on people. Geropsychology. Psychology with old people. It is, so the population is a lot older than it used to be. People are living longer. And because of that, you know, you might have different needs in your 80s and 90s than you had in your 40s and 50s. So what's normal, what's not, how do we help people cope with age? How do we give people a good quality of life as they're getting older? And so I said I was a clinical health psychologist, but I work in geriatrics. So I do home visits with veterans who have a hard time getting into the hospital. And typically that's because they're older. So they may not be able to drive anymore, or maybe they have Alzheimer's, so it's not safe for them to drive, or maybe their wife or their loved ones can't drive them to the hospital. So I do a lot of geriatrics. Health psychology I mentioned earlier, I already said this is how you help people make healthier decisions, how you help people cope with a health disorder that they already have. So you might go to a neuropsychologist when, let's say you had a concussion or you're having trouble remembering things and you're not quite sure what's going on. They will test your memory, concentration, your cognition, and figure out what's going on. So you might also go to one, let's say if you had ADHD and you were trying to get diagnosed. That's what neuropsychologists do. And one of the things that's interesting about neuropsychology is there's been a lot of testing, so they have these norms. Like, okay, most people your age and with this amount of education can remember this or can do this in that certain amount of time. So you can figure out how you would perform compared to your same age peers with the same amount of education. So their degree process is very similar to, most of the neuropsychologists are clinical psychologists. And they do like testing batteries for people. We have them at the VA and they may be working with people who had traumatic brain injuries or had concussions. Industrial organizational psychologists. Any guess there? They work in industry and organizations. How do you make people productive? How do you set up management in the best way to get people working? That's what they do. Psychometric or quantitative? Yeah, they're the stats people. So they're the ones who try to not only understand statistics, but improve them. Like, okay, we're doing it this way now. How can we do it better? How can we be more sure about our answers? How can we reduce the chances of finding false positives? And you might see them working at maybe like the people who do the SATs, so ETS, and other places too, maybe the Census Bureau for the government, social psychologists. How do we function in social settings? Howard has a lot of social psychologists in their psychology program. So when I started psychology, I was doing a lot of social psychology research. So they might understand kind of why people make the decisions they do in front of other people, how we interact. I think at Howard University, they'd like to focus a lot on how things like race or racial identity might impact things that people do. So that's one interesting way to look at it too. Anyone have any, want to guess what a sports psychologist is? Yeah. Yeah, concussions, in addition to how do we make athletes better, how do we get them performing in different ways. I think there used to be a show that talked about a sports psychologist, but yeah, that's what sports psychologists do. All right, well, you guys were really great at kind of figuring out all the different types of psychology, and I say this because maybe when we started you weren't thinking that there were this many different fields of psychology, but there are a lot of different ways to understand what people do and help them. Whether you're working with them one-on-one or maybe you're just doing research to better inform decisions and understand things. So the reason I point out work in a healthcare setting is often people are like, why in the world is there a psychologist here? I need to see a real doctor, not you. But often if you think about it, if you're dealing with a medical disorder like cancer or Alzheimer's, you might feel more anxious or more sad. You need to learn new skills to deal with what you have going on. Often a lot of the things that people do in health settings, there's a behavioral component. So I might get a referral for a patient, they're like, he's not taking his medication. Why? And then you try to figure out, okay, is he depressed? Does he not remember to take his medications? Does he not think he doesn't have the disorder, so he doesn't think it's reasonable for him to take it? Or is it too expensive and that's why he's not taking it? So there are lots of ways in which you can help in those settings that people might not necessarily think of. How much do psychologists make? So this is the national average of what psychologists make all across the country, and it puts all these psychologists I just mentioned lumped together. I will say in the DC, Maryland area, the average is closer to 90,000. I think just because it's a higher cost of living. And I got asked the question before, how much do I make? And I make about 95 as a psychologist. Now, one thing I will say is, one thing to keep in mind is psychology is one area where there continues to be growth and job opportunities. So I do think it's a place where we're not going to run out of the need for psychologists anytime soon. And the different types of psychology I mentioned make different amounts. So clinical psychologists tend to get paid more than maybe a counseling psychologist or community psychologist. But I would probably make a lot more in private industry working with like a business or industry than I would necessarily with the federal government. I don't know what the average pay for professors is, but they're not hurting either. They're not super rich, but they're not hurting. And what do I do? I've been talking a lot about mentioning that I work in the field and I go to people's homes, but what does my typical day look like? So right now, I mentioned I work in home-based primary care at the VA, and my typical day, I might see 2 to 3 patients because I have to drive to their houses. So I might go see someone in Clinton, and then have to go see someone in Fairfax, and then have to go see someone in Silver Spring. So I do spend a fair amount of time in my car, but I go into someone's house. I might be assessing for depression, anxiety, cognitive functioning. Sometimes it's caregiver stress because let's say you're caring for someone who has a disease. That can be stressful. That's a lot of change. You're having to do things for them you didn't have to do before. So if I can do anything to reduce caregiver stress, that helps the veteran in the end. I also occasionally sit on team meetings, so I meet with the doctor, the nurses, pharmacists, physical therapists, clinical dietitians, and we try to figure out the best way to help the patient and kind of put all the information we all have together about them to give them the best care possible. So when I was a postdoc, I said I worked in pain clinics, so I would see closer to 7 or 8 patients a day, but they would be coming to me, often referred by their physician, and not happy about having to talk to a psychologist because they thought that meant the doctor thought their pain wasn't real. And that's not why they were getting sent to me. It was often they're having a really hard time dealing with the pain. And there's a lot of evidence that shows there's a benefit of psychological interventions, relaxation techniques, how we think about pain can even impact how much pain impacts us or what it stops us from doing. For example, there's a study that shows you had, during World War II, you have soldiers coming in with amputations and all these injuries reporting less pain than civilians who had less injury. And often it's because they were thinking about the pain differently. If you're like, I'm out there fighting for my country, I sacrificed and kept people safe, or, you know, this is going to get me to go home, you're in a much different mind state than someone who's like, I shouldn't have been involved in this, I'm a civilian, how did this get brought to me? So even how we think about pain can impact how much of it we feel. And yeah, so I would work with people, see how pain is impacting them, try to get them some resources to cope differently. And I mentioned earlier I would get paged in psych in the hospital. So I might get a patient who's seeing things, I might get a patient who's sad, a patient who's throwing stuff, someone who's refusing treatment. I also worked in the emergency room, so people were coming in with thoughts of wanting to harm themselves or somebody else. What type of help do they need? Bariatric surgery, so doing evaluations for people who wanted to have the surgery that makes them eat less so they can lose weight. I worked in oncology, so working with people who have cancer diagnoses who are in the hospital or also outpatient are some things that I did. Professionalism tips. So one thing I always tell people is networking, because you really never know where that job's going to come from. The job I have now, I found out about through a friend through grad school. I had been applying for things at the VA, hadn't really been hearing anything back, reached out to her, and she knew about something that just hadn't been posted on the website yet, or had been taken down, and she sent my resume along. And that's how I found out about it. Now I was qualified for the job, but I would not have known about it had I not kept those connections from grad school. So things like going to conferences, doing summer programs, doing mentoring, let you meet other people across different disciplines, but also within your own, it can lead to other opportunities. You could also do research grants and products across different universities, so that's something to keep in mind as well. You do a lot of, you'll become a much better listener in psychology. Typically, I don't talk this much at work. The patient does most of the talking. And empathy. So you're going to be dealing with people who have issues, who are struggling. And often when people are struggling or in pain, they might act out. They might be angry with you. And you're just like, well, I'm just trying to help you. So trying to find a really big empathy base is something that's important as well. And there's a lot of ethics, kind of what you can say, what you don't say, respecting people's confidentiality, not taking advantage of people. So you really try to avoid multiple relationships in psychology. So I would not see someone in therapy that I dated. I would not see my family in therapy. I would not see my coworkers in therapy. Like, those are lines that aren't appropriate to cross. I wouldn't necessarily have my patients tell me their house. That's too many relationships. You could be seen as taking advantage of someone who's put their trust in you. And so that's something to think of as well. And to be well-rounded. So yes, I'm a psychologist, but I do other things. I like to dance. I like to eat. I like to go to the ballet. I like to watch sports. So, you know, you got to find some balance so that your whole life isn't just taking care of other people. You sit in the room and help them, but not internalize all the things that are going on. One thing I found helpful when I was in grad school was being in therapy myself. So if you're helping other people with their mental health, you have to make sure your own mental health is in check too, right? Like, you need a place to decompress or to talk about stressors. And I found that helpful for putting that distance in too, and not being overwhelmed. And that's why I put the self-care part as an obstacle, because if you're not caring for yourself, you're going to get run down, and it's a lot harder to care for someone else. I often use the airplane analogy, that you put your mask on first before you put someone else's on. So if you're not eating, you're not sleeping, you're not giving yourself the benefit of doubt in situations, you might not also care. So I think it's something most programs could improve on. They try, but I think it's a challenge. And often if you're going in with a student mentality, you're like, I have to get this right, and I can't tell anybody I'm not sure if I do this. You might feel a bit of an imposter in the beginning. Like, well, okay. And you know, your first few patients are rough because they know you're new. You know you're new. And kind of giving yourself a break. And I often tell patients, you're the expert in you, I'm the expert in psychology. If we put those together, let's figure it out. So I'm not kind of trying to reduce that power dynamic that goes on. All right, future outlook. There continues to be growth. Is psychology a STEM discipline? Not traditionally. It's not in the definition. It does not count. However, I feel you have a discipline that studies human behavior, often with the scientific method. So in my head, that's a STEM career. If you're going in there to understand problems, we're creating hypotheses, we're testing it, we're coming out with knowledge, it could be considered a STEM career, but you're not going to find it funded necessarily through STEM. What I will say is you use a lot of STEM within psychology. So I talked a lot about statistics, math. If we're talking about technology, so different ways that people interact with it, coding in computer coding was helpful for me in stats because some of the stats programs you have to write code to get it to run. So the computer science classes that I took here at Howard were helpful when I was starting to write code to do statistical analyses for my dissertation.